Hello, my name is Beth Hammers, and I'm the CEO of Marshall Health. Joining me today is my primary care physician, Dr. Larry Dial, and my gastroenterologist, Dr. Wesam Frandah. Recently, I had a health scare, and thanks to these two individuals, I'm doing well today. Together, we hope that this segment will be informative and will encourage you to schedule your colonoscopy if you haven't already done so. Several years ago, Dr. Dial encouraged me to schedule my colonoscopy, but I put it off due to COVID. And like so many, you never think it's going to happen to you. That is colon cancer. 3 years later, and thanks to Dr. Dial's persistence, I finally had my colonoscopy. And I'm so glad I did because Dr. Frandah found cancerous polyps during my procedure. Thankfully, he was able to remove the polyps before the cancer had spread, and now I will be conducting regular check-ins on an annual basis. I tell you my story because if I had waited just another year, I'm afraid it would have been a different story to tell. So let's turn to the experts to learn more about why colorectal screenings are important. We're going to start off with you, Dr. Dial. So why did you refer me for screening, and who should be screened?
So in a primary care office, we address many things. Some of them are acute issues that we deal with day to day. More importantly, really how to keep you healthy. So looking across the continuum, depending upon your age and risk, we may recommend certain tests or certain procedures. Colon cancer is a leading cause of death in the United States. And unfortunately, in West Virginia, we have a high incidence of both colon cancer and other cancers, but also a lower rate relative to the nation as far as colon cancer screening. In addition, recently, over the last couple of years, they've changed the guidelines as it relates to colon cancer screening and taken it from age 50 down to age 45. So it's important that when you see your primary care physician to address all those issues related to healthcare screenings.
Are there any signs or symptoms that our audience should be aware of?
It's a good question. So for most screening tests, we are really looking for issues as it relates to colon cancer or other issues before symptoms occur. And really the hope is we would find these in a stage where we can cure them. So we can do a procedure, we can identify this and fix it before it actually causes symptoms. However, if you're having symptoms, and again, symptoms such as diarrhea, changes in your stool, bleeding, or anything that is out of the norm for you, definitely seek your primary care physician out and get a test done. But for most screening procedures, including colonoscopy, there is no symptoms, and this really is a proactive preventative measure to prevent colon cancer. What we're really trying to identify is polyps. So what we do know, frequently you can find polyps on a colonoscopy. We know that with time, those polyps can proceed on to cancer. And on average, that's around 10 years from going from a polyp to a cancer. So if we can identify them early on, you can remove them and prevent a future cancer and problems associated with that.
Dr. Frandah, what is colorectal cancer?
Colorectal cancer is a growth in the lining of the colon, and can be a colon cancer or colorectal. So it means either on the colon or rectum. Cancer happens from polyps, which are precancer polyps. Can be comes in different shapes and sizes, and some of them are on like a mushroom on a stalk, and some of those polyps are flat like a carpet. And some of those polyps can be adenomatous, and those are the ones that are precancers, and we worry about them to be removed. And some of those are very benign, some like hyperplastic or inflammatory polyps.
Dr. Frandah, I don't think anyone looks forward to a colonoscopy, but I know there's been many advancements in the field. So if you can elaborate on the process as well as the prep, I think our audience would appreciate it.
Very good question. So the screening procedure starts from patient before arrives. So which from the important step is the preparation. And there are several recent advances in the preparations with a smaller volume and more easily palatable solutions that can be taken. There's also recently FDA-approved medications can be oral tablets only, so that's been taken. So with all these measures, the preparation of the colon for the colonoscopy is much easier than it used to. The other thing is once you get the prep, which is we give the patients visual diagrams to tell them what would be ideal for the preparation before they come into the procedure and avoid rescheduling, so to have an optimal examination during the procedure. The next day when they come in to the procedure, they'll get checked in by the nurses, and the anesthesiologist will come talk to them. They'll put an IV, which is will be given for the sedation, and we do these procedures under sedations. During the procedure, we'll pass the endoscope all the way to the end of the colon, which is a place we call the cecum. And one of the things we use here in Marshall is using the artificial intelligence, which is one of the cutting-edge technique for detection of polyps in the country. And these kind of help increase the detection of those polyps and the precancerous lesions. After that, once we finish with the procedure, patient will be taken to the recovery. And some of them, when I come talk to them, they'll say they'll have a best ever sleep they had during the procedure. And based on the polyps or what we found, we'll give them the recommendation what will be the interval screening.
Well, how often should a patient get a colorectal cancer screening?
Depends on what's the initial exam. So, for example, if somebody had a colonoscopy and didn't find any polyps, they'll get a 10-year surveillance interval. So they give them a 10-year pass. Now, it depends if we found the polyps, the size, and the number of those polyps can be a 1 year, 3 year, or 7 years, dependently. If somebody has a family history of colon cancer or some genetic history, then the interval might be much shorter. So,
And in my case,
will be
annually?
so.
I'm just wondering.
So the first one for you is, since we took the polyp out, we did the surveillance for the scar, and that was negative for any residual polyps. So the recommendation is to have the repeat is 16 months from the initial colonoscopy, which is a year from the last colon. And then if that's negative, we're going to go to a 3-year interval.
Excellent. Dr. Dial, how does a patient schedule their screening with Marshall Health, and do they need to talk to their primary care provider first?
Yes. So you need a order to actually have colonoscopy completed. So reach out to your primary care provider, discuss it with them. That way they can go over what are the indications, what are the problems and challenges as it relates to you specifically. Again, the preparation may need tailored to the individual patient. So by reaching out to your primary care doctor, they can help guide you through that process. The primary care physician then can order the test directly. So we can order those by referral to Marshall Gastroenterology, and the patient can just be seen the day of the procedure. That way, it can be facilitated quickly. The gastroenterologist will call you. They will have a staff member who will call and help you through the directions related to the preparation and what to expect on the day of endoscopy.
Thank you, Dr. Dial and Dr. Frandah, for taking care of me and for taking the time to answer the questions today. I thank you for joining us, and I hope that you feel you are more informed and more willing to schedule your colonoscopy, because it could save your life.